Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics and emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our health talk is a role of zinc in our body. Joining us today as our guest speaker are Dr. Ananda Prasad, who is the pioneer of discovery of zinc and its effect on the body. And he's going to talk about some of the highlights about the zinc, what it is, and how it affects our body. Joining us today as our another guest speaker is Dr. Sheila Mehta. She is an internist with the Wayne State University, and Sheila is going to introduce Dr. Ananda Prasad.
Dr. Prasad's pioneering studies from the Middle East in the early 60s established for the first time the essentiality of zinc for human nutrition and showed that its deficiency occurred in humans. The impacts of this discovery have resulted in saving of many lives, its use in children with acute diarrhea decreasing the mortality, and its use in the elderly with age-related macular degeneration for prevention of blindness. In December 2009, Time magazine named zinc the miracle mineral. Dr. Prasad, a distinguished professor of hematology oncology at Wayne State University School of Medicine, is author of 12 books and over 300 scientific articles. Several of his papers have been cited as citation classics. One paper was republished as Nutrition Classic and another as a landmark article. Dr. Prasad was presented with the Outstanding Research in Medicine Award from the American College of Physicians in 2007. Dr. Prasad received a congressional commendation in 2011 for his lifelong studies involving zinc. Also that same year, he received a prestigious Mahidol Award from Thailand for his contributions in the field of zinc metabolism. Dr. Prasad was recently inducted into the American Nutrition Hall of Fame at their 62nd annual meeting, Personalized Nutrition 2021 Mapping the Future, on September 28th, due to his monumental achievements in the field of nutrition. His zinc studies have saved countless lives in African and Asian countries, including India, Pakistan, and Bangladesh. Dr. Prasad continues to be a trailblazer in the field of nutrition.
Thank you very much, Sheila, for your introduction. And we are very privileged to have Dr. Prasad on our health talk. And Dr. Prasad recently was inducted to the Hall of Fame for American Nutrition. And he also published a book that I will show at the end. There is a 5 minute video of his life, which will be projected later on for everybody to see. So good morning, Dr. Prasad. How are you?
Good morning.
So,
Good morning.
Dr. Prasad, we are very much privileged to see you today on my health talk. And all the work that you have done is just amazing. It's amazing, hard to believe. You have done so much. I just wanted to get just a few questions. I'm going to ask you. These are so. How do you? What do you say about what is zinc element for in our body? As you know, our show goes to all over, the listeners in these local areas and all over. So they would like to know a little bit more about the zinc from the expertise like you.
Dr. Prasad is really the founder of zinc deficiency.
Everyone in the world knows Dr. Prasad as a specialist in zinc.
Zinc deficiency probably involves about a third of the population in undeveloped countries, particularly in young children, and causes a lot of fatalities.
The fact that people in developing nations now are able to survive and thrive and grow and live normal lives is huge.
In my experience, he's the person who's achieved the most in terms of combining really good science with an impact on public health that I've ever known or known of. So he's really been a giant in the field.
I came of a very large family. I had 2 brothers, 4 sisters, and they were all very kind and affectionate to me. When I was 6 years old, I wanted to go to the same school where my older brother was. He was in this district school which I started from 4th grade to 12th. I was clearly not prepared. I did very poorly the first term, and my father told me that you have to come back home and get prepared. But I told him that I want to try one more term, and I worked very hard, and I stood first in my class. And after that, I always stood first. We were not familiar with United States in India at all. But after independence, they were trying to get Indians familiar with what was going on here. The concept was developing in USA that physicians should not only be clinicians taking care of patients, giving medicine, but they should also be scientists. Because if there is a disease, if there is a problem, the physicians will then be able to take it in the laboratory and work as a scientist to understand. And I thought that it was a great program. After I finished my training with Cecil Watson, Professor Hobart Ryman, he was chief of medicine at Jefferson in Philadelphia. He was also a personal physician of Shah of Iran, and the Shah invited Hobart Ryman to go to Shiraz Medical School and set up a medical curriculum just like the American medical schools. And he accepted that position. Now he wanted a young man to help him do this job in Shiraz. So he contacted Cecil Watson, and Cecil said that since I was waiting for a position in India, maybe I could go to Iran and help him. I accepted his challenge, went to Iran, and there I discovered the zinc deficiency problem.
The story with Dr. Prasad and the zinc is a fascinating story, and it's a really fun story.
He traveled to Egypt and Iran and with an American group, and they were puzzled by the villagers in these countries. A lot of the young men turned out to be dwarfs.
And one of the habits these young men had, as he described it, was they were eating clay, partly to overcome their hunger, but partly to overcome some of their mineral deficiencies.
What he realized was that by eating the clay, the dirt was actually leaching the zinc out of the children.
It was already known in the literature that zinc was essential for the growth of rats and plants and pigs. I thought that, well, if zinc is a growth factor for the animals and the plants, perhaps I'm looking at zinc deficiency in human.
It turned out that when he gave these dwarfs zinc, these young 25-year-old dwarfs grew from pre-adolescent boys to adult men.
All my colleagues got together, we celebrated that we have really discovered a very important element for human health.
Ananda's a family man. He's very excited and loves and talks a lot about his children and grandchildren.
Others know him as a scientist, but Ananda would first refer to himself as a husband and a family man, a father, and then as a scientist.
I have very close relationship with all my children, and my wife has been a great support for me in every respect.
I view him and his wife, Arabella, as good friends. They've traveled the world in spreading the word about zinc, and he has inspired the work of a lot of young scientists. I was one of them.
He reminds us all that we're all really students. It doesn't matter if you're assistant professor or professor at the beginning of your career or in the middle, we're all students.
It gives me great satisfaction and pleasure to look at that here I was many years ago. I opened up the whole world of zinc, completely unknown, but this legacy is going to last. First, I like to say that a periodic table, we have 92 elements, but there are only 8 that are essential for human biology. These are iron, copper, zinc, manganese, chromium, and fluoride, iodine. You know, but it turns out that zinc is very unique out of these essential elements. All the other elements that I mentioned, they have limited role in human biology. They affect the enzyme activities. But so far zinc is concerned, we have learned that there's something like 2,000 zinc-dependent transcription factors, and therefore it is involved in the messenger RNA of all these proteins in this human biology, 2,000. And this is phenomenal. And one wonders why nature used zinc. My personal guess is that zinc is a very stable molecule, and it does not give off any electron, so it does not damage DNA. And the nature has used this in the transcription factors to express messenger RNAs of 2,000 plus proteins. Now, most importantly, what it does is it affects the growth. It's a growth factor. None of the other elements that I have mentioned before, even though they are essential, none of them have any effect on growth. In case of zinc, it is a growth factor. It is not because it is affecting the human growth hormone. It is affecting really the incorporation of thymidine into DNA molecule, and it converts thymidine monophosphate to thymidine triphosphate, and that's the one that DNA molecule uses. So if this is not being generated, DNA will not be doubled, cells will not divide, and there will be no growth. And that's exactly what we found in our human studies. And it turns out that the enzyme that is taking care of uh, conversion of thymidine monophosphate to thymidine triphosphate is deoxythymidine kinase. And the zinc is involved in the messenger RNA of deoxythymidine kinase. This discovery was done almost 30 years ago. It's a very important discovery, and the first to point out that zinc is required for gene expression of proteins. So the other two effects that are very critical for zinc deficiency, One is the cell-mediated immune function is adversely affected, and also oxidative stress is increased due to zinc deficiency. And as everyone knows that the two things, increased inflammation and increased oxidative stress, account for all the diseases that we know of currently, including atherosclerosis. It is now, cardiologists think that perhaps chronic inflammation, oxidative stress is responsible for atherosclerosis, Parkinson's disease, neurodegenerative disorders, and even some of the cancers, such as prostate cancer and colon cancer. So you can see that the effect is very widespread, and it's very important to learn about all these factors.
So, Dr. Prasad, for our viewers to know, um, how much zinc is a requirement for persons like us, and what are the symptoms of zinc deficiency that we should be watching in us before we go back to the supplemental zinc?
Yeah, yeah. Well, there's a major confusion has come up with some of the committees who have been looking at zinc, and they have really misrepresented the facts. The facts are that in order to produce, there is only one side effect of zinc, and that is copper deficiency. And in order to produce copper deficiency, we had to give something like 75 to 150 milligram of zinc a day. And you don't produce copper deficiency if you give 20 milligram, 30 milligram, even up to 50 milligram. You do not produce copper deficiency. We gave 50 milligram to elderly subjects for 12 months, and there was no effect on copper. So that is a misinformation in the community, in the literature, and people are just, they don't know what they are saying. Now, the other thing is that we have the first um, National Research Council meeting in 1974 outlined all these effects and the requirement very beautifully in a book. Uh, it was published by National Academy of Sciences. And if you look at that book, that gives you different ranges for younger age group, uh, than adults and elderly people. And we have, for the elderly subjects, we are recommending to give 45 to 50 milligram of zinc a day because their requirement is higher. The reason why it is high because they're, first of all, they don't eat enough calories. They're supposed to take 2,000 calories, but they eat only 1,000 in our survey. And the other is that most of the proteins are coming from the cereals, and cereals have organic phosphate compound phytate, PHYTATE. And this phytate binds zinc very tightly and makes it unavailable for absorption. And we think that's the major mechanism why the elderly are becoming deficient. They have high phytate, low calories, not enough intake of animal protein. So if you correct all that, we found very significant effect. Number one is that the incidence of infection went down by 66%. For instance, there would be
Amazing.
8 or 10 common cold and pneumonia and meningitis and all that. And now they were getting perhaps one in a whole year. So that's a very significant effect. And the other is that it also decreases oxidative stress. And what this does is that it prevents LDL to be oxidized, low density lipoprotein to be oxidized, and therefore there will be no clot formation in the arteries and veins and so on and so forth. So those are the three major effects that I consider for zinc: oxidative stress and the inflammation and immunity.
So, Dr. Prasad, I went through the literature. I'm amazed to see all the articles that has been published. So, one thing that excited me, the role of zinc in the sickle cell disease, because children suffer from sickle cell disease. So, what would you advise the sicklers? Should they be taking preventive zinc
Yeah.
at the form of lozenge? How would you advise them, the
Okay.
sickles?
Well, for zinc intake in the younger people, we have recommended 10 milligram of zinc for uh, infancy to age 10, and
10 milligram.
yeah,
And this
10
is
milligram.
zinc sulfate, not chloride, right?
Uh, yeah, well, you
Is it
can give zinc acetate,
zinc
zinc
acetate?
chloride is zinc chloride is not a very good
Right.
so because it will produce more acidity in the
Yeah,
stomach. You want to select acetate or
acetate.
gluconate. Those are
So
the two.
for our viewers to know when they are looking for the lozenge, they should look with the zinc, with the acetate, not
Acetate,
with the chloride.
not chloride,
Right,
and not oxide, because oxide is not absorbed. So
right.
you have to be careful what you select to supplement. And my preference has been acetate or gluconate.
Would you advise them now? This is still the COVID pandemic going on. It's
Yeah,
hard to say which one has flu, which one has COVID
yeah,
symptom.
yeah,
So
yeah,
would you like our people to just get
yeah.
zinc losses as a protective mechanism,
Uh,
preventative for prevention?
well, actually, for COVID, um, uh, we think zinc is a very important killer of
Yeah,
COVID-19. Very
right. I read
important
that your other
uh,
article
for
about this.
for two reasons. One is that zinc prevents or it inhibits RNA-dependent RNA polymerase, which is an enzyme required by COVID-19 to
Right.
survive and live, multiply. So if you inhibit that enzyme, the cell, these, this COVID-19 cells will not survive. And then if you add 5 milligram of uh, hydroxy, hydroxychloroquine, as a supplement, which works like a ionophore. It brings zinc from outside to inside, and it increases the concentration. So you kill the cell. But then there is another effect of zinc, which is independent of that. And that's the one that we are investigating currently. If you activate thymolene, if you activate thymolene and use active thymolene to produce T cytotoxic lytic cells, and these cells will kill the, the COVID-19 directly. So you have a double killer effect. T cytotoxic lytic cells will kill, and the enzyme will also kill. And we think that could be a very powerful uh, technique to treat these COVID-19 patients.
Dr. Prasad, I have this there's a mostly recent published book by you, The Essential and Toxic Trace Element and Vitamins in Human Health. And I also was lucky to attend your meeting when you were inducted to Hall of Fame for Nutrition. And for our general public to know, they can go through all the dietary substances that are rich in zinc,
Yeah.
and hopefully they include it in their daily diet. Do you agree with me, or do you have any more comment about this?
Uh, no, I think that's correct. If you look at that book, we have a big table for
Yeah,
recommended dietary allowance. And if you follow that for zinc, it will be very accurate, very accurate. And actually, we confirmed that more in the experimental human model of zinc deficiency. We did that study for almost 15 years at in collaboration with University of Michigan CRC unit, and I think we learned a lot about zinc and its effect in this experimental model. First, the model was very controversial because people will say that, well, how can you restrict zinc in the diet when it is essential? And the other side would say that, well, we have to learn the a specific effect of zinc. Because if
right,
you just take people with zinc deficiency in the villages, you don't know if they have enough lysine in their cereal protein or cysteine, on all sorts of things. But here, we had exactly the same diet, and only we changed was the level of zinc. So those papers are very classical, and very important, and very illustrative of what happens in zinc deficiency.
so this is so good to know about for everybody the real role of zinc in our body. We have a very interesting story about you, that you suffered from COVID and you treated yourself, and that write up has been circulating all over the world.
Yeah,
How, as a physician, you treated yourself with the treatment, with the zinc and hydroxyquinone. I do not know if we will be able to cover that particular segment, but we will be very happy to have you again
yeah,
to
yeah,
share your personal
yeah,
experience with the whole thing.
yeah. Now, sickle cell turned out to be a very interesting model for me to study.
Right.
I was sitting in my office, and one of my residents brought a patient who was 21 years age but looked like 8-year-old boy. And I thought he was a zinc deficient boy from Middle East, but that was a sickle cell patient. He was not growing because he was losing a lot of zinc in the urine, and because of that, there's deficiency. And their diet also did not have proper uh, zinc content. So we use that model to study sickle cell growth, immunity, and,
Yeah.
and
And
many
it
other
has
things.
been studied all over the world, your articles and everything. And personally, I'm so much proud for all your accomplishment in life. And Dr. Prasad, we will try to have you again at your convenience. Then you can talk about your personal experience. And we have a 5 minutes video, which is very, very interesting for everybody to know. And I like to thank you very much for coming to my show. And I like to thank Dr. Sheila Mefta for being my guest speaker. And until I see all of you again, have a very safe, wonderful fall and winter. Just we want everybody don't to forget zinc lozenge for flu
Oh,
and cold.
okay.
Thank you again. I like to thank our producer, our camera people for helping us preparing this wonderful video. Thank you again.